Well, guys, I'm just thrilled to talk to you today and introduce to you Jennifer Boyd. She came through training a couple of years ago, and she has built her business quite successful. This is a picture when she was graduating there at our little ceremony we do at the end of the training class. And as you can see, she's holding up her little certificate there where we certified her. So let's see if she's still on the line. Jennifer, you with me?
I'm still here. Thank you for having me.
All
Can you hear me,
right.
Patrick?
I sure can. Thank you for showing up today. I know you're busy. You were out there doing some things today that were pretty exciting, weren't you?
Absolutely. I was. I'm really excited that I was a little late on the call, but I was able to land 2 clients today. So that's always an exciting time whenever I'm able to land clients and share with the world how that went about.
That's worth being late for, isn't it? Well, Jennifer, let's start back 2 years ago, since I'm showing this picture of you here when you were graduating back then. Give us your feel for the training workshop and how it went and the instructor. And so we'll just kind of tell your story about that.
Sure. So, I went into the training sort of already prepared to launch. I had the mind frame, and I really contribute this to the success that I had. I had the mind frame where instead of going in and trying to figure out what it is that I was going to be learning, I kind of went into the training already prepared to launch. So I did a lot of the research, a lot of the things that I needed to brush up upon in terms of healthcare. And then when I arrived at training, it was just not only a fun experience, but very educational experience coming from Cynthia Anderson, who's amazing and funny. And she kept us engaged, and she took real life experiences, brought them to the table. She took people from the audience and said, what background do you come from? And she really engaged the audience to make it, it felt like hands-on learning. You were there, you were really learning about the healthcare, the industry, and then billing. And then for myself, I felt that I walked away with basically everything I needed to close the loop so that once I get out there, I could hit the ground running. So instead of it being sort of the starting piece for me, it was the ending piece where I just needed to close all of the gaps at training. And then once I got out there, land clients as soon as possible. So overall, a wonderful, wonderful experience.
Yeah, Cynthia's fantastic, isn't she? By the way, folks, I don't know if we made this clear, but Cynthia, and some of you on previous webinars have probably heard this, she is a licensee. She signed up. Now get this, Jennifer, she just celebrated just 2 or 3 months ago her 10th anniversary.
Wow, how amazing.
Yeah, she's got, I think she said 11 people working for her. And of course, with people like that, you can just leave town for a week and come down to Texas. She gets a little break from her two boys and her husband. And, hey, by the way, I'm just going to turn my webcam off here, folks, because Jennifer was having a little technical difficulty, couldn't turn hers on, so I feel a little weird here just talking to you. We'll continue putting up pictures of her here in just a minute. In fact, Jennifer, I'm going to put the one up here that you just had made. This is of you sitting there at your desk with the word boss up on the top shelf. I see it back there. So very nice. You had somebody professionally come in and do that, didn't you?
I did. Yeah, that's my new office. And, just that one word speaks volumes. It really, the goal of my life was not necessarily to be the boss, but to be a leader, in everything that I do. As you know, I lead a nonprofit charity, and then that's my nonprofit, and then my for-profit, of course, is Prosperity ND, which is the billing company. And being the boss really is just being a good leader. And so that's why when I saw that, actually, that was a gift. It was given to me by one of my best friends, and for her, it was probably a fun idea to give me that. But at the same token, for me, it just meant that, it's important that in becoming a licensee, you're really becoming a boss. You're becoming a leader. You're becoming someone in your world and in your community, someone that people are going to look up to as an expert. And so that word alone just kind of encompasses a bigger role that you play when you become a licensee.
Well, and that's what a lot of people are looking for that are on the webinar today. Probably they're here to learn how to be their own boss, and
Yes.
that should be the goal of every American, as far as I'm concerned. I know that I read a statistic somewhere that said that something like 86% of all self-made millionaires, became millionaires because they owned their own company. Because you get to keep all the profits, don't you?
And yeah, and we get to create it the way we want to. So that's the fun part of it.
Yes, and Jennifer, you mentioned your nonprofit organization. Can you tell us just a little bit about that and why you started that?
Sure. So in 2013, I started a nonprofit called Mommy and Me Cancer Foundation, and I felt compelled to help mothers that were raising minor children, but they were also battling cancer themselves. So we really focused on creating programs that were going to give them financial, emotional, and educational support to the children, and then also support to the moms as they battle through life-threatening disease. So it's a very unique niche, and that's kind of where when we have fundraisers such as our big 5Ks, all of our funding is focused on treating and addressing that demographic.
Oh, that's fantastic. And, I love to hear stories like that, Jennifer, because that makes me feel good that, having your own business, us helping you get that business started, allows you to do things that you might not be able to do otherwise if you held down a, you know, 40, 50 hour a week job.
Yeah, that's very true. In fact, that's one of the reasons why I started Prosperity MD and decided to become a licensee with you guys is that I wanted to still continue my work with Mommy and Me, the charity, but at a lower capacity. And but at the end of the day, I still need to bring income. So that's where the for-profit came in. And, it really, because I'm still staying in healthcare to a degree, it really was a good fit for me. And then just having the autonomy to take care of my two young boys and then still be able to work from home, have my own office as you see there, and then still be able to run my charity, that was really important to me. So this opportunity allowed me to do those things, all of those things.
Yeah, and that's the wonderful thing about having your own business. You can do things that you might not be able to do otherwise. Okay, so tell us a little bit about how you got started. And folks, by the way, this is your opportunity to ask somebody who's an actual graduate of our workshop here in Texas, directly to Jennifer. So if you've got a question today, it should be addressed to her about her experiences, her business, etc. And I'll read those out, and I think Eric's going to be on here kind of monitoring that, and he'll jump in here if he's got some questions that people are typing in. So,
You bet.
Jennifer,
All
tell
right.
us, where you began, how you started. Give us a feel. Most people are wanting to know, how did you get your first client? How long did it take you? And, give us the growth story.
Sure, sure. Okay, so it's been 2 years, about 2 years since I went to training. And when I graduated from training, I want to say about 2 weeks after training is when I landed my first 3 clients. So I remember us talking about this before. I quickly landed 3 clients, and a lot of people said, "Wow, that's a lot. That's so fast." And it was a lot all at once. However, there was a learning curve. It was a great experience to have these 3 clients at first. So it was a primary care doctor. It was primary care doctor, another primary care doctor. I'm sorry, it was a primary care doctor, a nurse practitioner that worked with the primary care doctor, and then it was a cardiologist. So out of those 3 clients, 2 years ago, I've kept one. Kept is a key word because I now am in the position where I could choose my clients. So at first I started with 3 clients, one being nurse practitioner and a primary care doctor. Well, I've decided to then kind of fine tune my business even more to where now I only service surgeons and specialists. So I work closely with
Because that's where
neurosurgeons.
I'm sorry, I was just going to say, because that's probably where the money is, the big money, right?
That plus those are usually the sickest patients. If they're having, heart disease is obviously the number one killer in the United States. I felt compelled to help cardiologists as much as possible, because then if I help them, they could focus on their patients who need them. And then always, obviously, a lot of patients are having stroke. They're having to deal with different ailments. Neurosurgeons deal with probably some of the toughest of patients. So I don't know. I guess I like challenges, and I somehow have gravitated towards specialists and surgeons. So since 2016, when I started, I've now, like I said, I focus only on surgeons and specialists, and now I've created sort of my own book of business. So aside from billing, I'm also doing medical marketing for them. So I will create their websites. I'll do a lot of their IT stuff, and a lot of times that engages them to see an interest in becoming more computer savvy. That's where I start to talk to the doctors about EMR, electronic medical records, and then I talk to them about the importance of how they can get paid better through MIPS or through the Medicare payer program system. And so just I sort of have done this step approach to gain their trust and their trust in me. And then I've also collected hundreds and thousands of dollars for these doctors. And then when they become extremely confident with me, that's when they decide, you know what, I want to transfer all my billing to you, because it just seems that you have a more, what I'd like to say, a modern cloud-based system.
Yeah, and the interesting thing is you've mentioned that you can do the billing for nurse practitioners. A lot of people don't realize that they also see patients, and they
Yep.
do the billing even through, maybe it's through the doctor that they're working with, but they have a separate billing for the patients that they see, don't they?
Yeah, absolutely. And they're usually very, very welcoming, the nurse practitioners. But yeah, typically you're going to bill them under another doctor.
Hey,
Right.
Patrick, this is Eric.
Yeah.
Questions come in. I think it would be a good time to ask this question. It's coming from Chelsea.
Sure.
It's question 2, Jennifer. And the question is, were these warm clients that you first got, are these clients that were already in your network? I guess the first 3 that you were talking about.
Great question. Yes, I knew these doctors. The first one is my own personal primary care doctor. So I
Yeah,
approached my own
sure.
personal doctor and said, hey, I'm going to be starting this. You interested to learn more about it? He said yes. Next thing you know, it turned into a demo, and then from there he said, let's do it. Let's try it. We did it, and then of course he had a nurse practitioner that worked with him, and then the cardiologist, Chelsea, to answer your question, the cardiologist was also a friend of mine. So I've known him for 15 years. They came from my warm market. And I do remember Cynthia, the trainer, talking about this, how once you get your foot in the door, and once you've really impressed a couple of doctors, all they do is they tell their friends, and you start getting referrals. And so now I'm getting my business from referrals. I don't even have to network anymore, because the doctors will go and tell their doctor friends, oh, you need to call Jen. You need to call Jen.
Yeah, I hear that from a lot of licensees that they did what we taught them to do. As you know, Jennifer, we teach about a dozen different ways to go out and market, but they'll try one or two, and then they'll find their first client, and after that, like you said, if you do a good job for them, they'll refer you to other doctors. It's a kind of a tight knit clique, isn't it, amongst doctors? They all know one another. They talk on the golf
Yeah.
course and at the country club, and so if they're having troubles with their billing and they mention it, of course, the other doctors will always jump in and say, well, I've outsourced my billing, and here's who does it for me. So
Yes, exactly.
yeah. Good question, Chelsea. Thank you for asking that. Now, as we go along here, Eric, you just jump in. I do see a lot of questions coming in there. So any of those that you want to address, you can. I did want to ask this one, as it's pretty common. People will ask this question. You're saying, of course, that you got these first doctors from your warm market. Um, Jennifer, you know that we teach networking, of course, both business networking and your own personal warm market. And some people are kind of scared to do that. They don't want to talk to their own doctor or their own friends and relatives who might know doctors. But that's a great source, isn't it? A great way to get started.
Yeah, it absolutely is. And I could understand the fear of, not wanting to talk to your own doctor or not wanting to talk to somebody you might know and telling them about what you do. However, in this industry, the number one thing is trust. And, these
Yeah.
doctors have to trust you. They have to, because they're handing over, essentially, if you've got them signed up for a contract where, you're collecting 5 to 8 to 50% or whatever it may be, you become sort of a very important piece to their book of business. So it's important that they trust a biller or they trust a billing company or an EHR company. And in our case, we do both. We provide a lot of services that are modern and cloud-based. Now, the physicians, they need to trust us. So going back to some of the concerns that you talked about, Patrick, with some of the people, you want to talk to people that you know, because that's how you make that connection where they can trust, they know you. So for instance, with my personal doctor, he knew if I messed up or I did something wrong, he could easily look me up and find me and call me, you know. that's one
Right.
that's one part. They need to be able to know you and trust you. So a lot of times in this business, especially, I feel like having a connection, knowing somebody is a good way to start.
Yes, and by the way, you said now that you're kind of relying on referrals and so forth, but I'm going to show a book here on the screen, Jennifer, that you would recognize. In fact, this is your cover. This is your cover of the book I've got here. Let me put that up there for people to see. This is the book that I wrote with Dr. Vicki Ratner, The New Thriving Medical Practice. And Jennifer, why don't you explain how you used this book to obtain some clients?
Absolutely. This is such an amazing book because I've literally gotten clients from this book. I just leave the book and I tell the doctor, call me if you have any questions. And then a lot of times there's that level of mystery. Of course, you're going to look into it and see. But then when they call me, I'll say, I'd love to sit down with you and talk to you more about my book. Uh, but they're like, what is this? What is this all about? What are you doing? And I, oh, I'm making doctors more prosperous. Did you want to know more? Did you have somebody in mind that I can talk, that you want me to talk to? And a lot of times they say, well, tell me more about the book. So I give them the reality of it. I'm like, look, it's changed. Your income has gone down. You know that in this Affordable Care Act era, it's very difficult to get paid. If you don't know, you're about to find out. And so it's important that you understand what's behind the overall picture of Affordable Care Act and why is it that we need to be updated in terms of IT and healthcare IT and all that. Why is it important? Well, that book explains it all. And it's coming from, of course, you who's a very credible source, and so is Dr. Ratner. So doctors really take to that book and really like the fact that it speaks to them.
Yes, and explain a little bit about why your name is on the front cover there as having written the foreword to the book.
Oh, okay. So I'm not sure, but I think I remember you calling me and you said, I've got a gift for you, and you said I would like to show you this book, and you could put your forward on it. And I said, really? And then and then you put the forward in the book, and I remember opening the mail. There was like this big huge box, and I opened up the book, and I opened up the box, and inside were a bunch of books that said forward by Jennifer Boyd, and I got so excited because I've never been an author before, but this is probably the closest I'll get. And I thought it was just great because I do endorse the book, but to have my name on there was a whole different experience. And I think that's why doctors think, oh my gosh, this is your book? Or, I just basically say, this is a book that I highly endorse and I want you to read it. And when they see my name on there, it just speaks volumes.
Yeah, it's
So thank
it's
you
a
again.
Oh, you're welcome. That was back when we first introduced the book, Jennifer, and
Hmm.
we had not made it available to any licensees, I don't think. And then, of course, because you did that initial interview with me, I gave you some copies of the book, as a gift. But now we're including that along with our license. People get this book with the name right there on it. And of course, the important thing is that it's got your contact information inside there. At the end of the forward is your company name, your web address, your phone number, whatever you want to have them contact. So it's kind of like a business card, isn't it?
Yes, it's like an expanded business card that could speak for you. They just have to read it.
Right. And of course,
And they
doctors are
do.
busy. We know. Yeah, and we know that they don't probably want to read the entire book. In fact, there's a lot of people nowadays that are just, they've given up reading. There's too much on the internet and other places to read. But
Uh,
the way we do it is we have you highlight certain passages and mark those pages with little sticky tabs so that when you give it to the doctor, they look at it and go, what are these tabs? Well, it's just some of the quotes, that we want them to zoom in on. And I think that's what's happened. Didn't you say you'd given out two or three of them and the doctors all signed up with you?
yes, that's true. Actually, left I left this book with I think that cardiologist that I was talking about earlier, the very first one. I left this book with him, and then I said, I think I put my business card right in front of chapter 7 because chapter 7 is a really important chapter. And so
Yeah.
I put my business card there, and I hinted to him, I said, read chapter 7 and call me if you have any questions. And that's when he was so intrigued. He said, oh, no, chapter 7, the title is how money flows into and out of your practice. I mean, what doctor wouldn't want to read about that,
Yeah,
right?
that's
So,
uh, that's really that's really why we wrote the book, is that doctors are not thriving right now in private practice. And we tell them here, the subtitle is how to get off the hamster wheel and work smarter, not harder, and generate more revenue and enjoy greater satisfaction in the era of the Affordable Care Act. Burnout is a big problem right now with doctors, and
yeah.
they want to enjoy the career, but it's hard to with all the government rules and regulations. Okay, Eric, you want to pick another question or two there?
You bet. Yeah. Marie Carmen's asking Jennifer, she'd like to know what would you consider your main problems when you got started? Any big obstacles that you had to overcome?
Yeah, just like with any business, there's going to be a lot of ups and downs. The biggest obstacle for me personally was um, having to learn a lot of information in a short amount of time with 3 clients. So I think that that's sort of a good problem to have. But
Yes.
but I wouldn't suggest for I would highly suggest for people to get maybe 1 or 2, not 3, because it was a lot of it was a lot of work trying to figure out what how to onboard these doctors in all 3 for the first time. So I think for me that's my biggest that was my biggest obstacle. But after that, then training the doctors and getting them on board was a lot easier. So I'm not sure if that answers your question, but the biggest that would be my personal obstacle that occurred after training, post training. I think one obstacle that a lot of people may have is just that if they don't necessarily have a lot of experience in healthcare, there's just going to be a little bit of a longer learning curve, just because there is a lot of acronyms and things like that that you have to learn and be familiar with. And again, these doctors will find you credible if you're very knowledgeable. They'll trust you if you're very knowledgeable. So I think that you really do have to take the time to become an expert at some of the terminology, which if you're very much involved with your business, you're going to want to learn. You're going to want to know, because I'm at the point now where I have about 7 people working for me right now. And I mean, in order for me to train them and in order for me to guide them to where they want to be, I have to be a good not only a good leader, but I have to know some of the material myself. So a lot of people are thinking, oh, I'm just going to start this business. Well, I think it's going to be to your best benefit if you get involved in the business as much as possible first, learn as much as you can, and then when you're at the point where you're ready to hire other people, you're going to know what you're looking for. You're going to know what you're looking for in an employee or a candidate. You're going to want someone who's internet savvy, who's maybe recently graduated from getting their biller or coding certification. These are things that I certainly look for, and I think it took me 2 years to learn certain things, such as that. What does the right person for Prosperity MD, working for Prosperity MD, look like? And so that would probably be like my second challenge, is just learning as much as I possibly can to become a good leader and a good role model to the people that are eventually going to be working for me.
Patrick, this is another good question to follow up with that, because Anna did ask, did you, Jennifer, have any medical billing background?
I did not have any medical billing background. No, I did not at all. So I learned, literally the first time I ever saw an EOB or even how to put in a claim or a diagnosis was at training. But I walked away from training. Yeah, I walked away from training saying, okay, I could do this. This is easy. It's really, like I said, that expanding your knowledge to learn more in depth is what's going to take some time. But, in training, they teach you a good enough information to be able to start.
Yeah, the system is really very user friendly, and we think of it as cutting edge technology. So that helps that it's a cloud-based system, and that it has an electronic medical records system that's built into it, as well as the billing module has a patient portal. It can be used on a tablet or a phone. All of those things make it. I think it helps people feel very at ease that we bring in laptops the very first day and have them get on those and start doing the billing. Did we do that 2 years ago when you were there?
Yes.
Yeah, I didn't know when we started that, but okay, Eric, I see one here that I wanted to also cover that Anna asked, and that was, how many clients do you have right now?
Right now, okay, so let's see here. 1, 2, 3, 4, 5. Right now I have 8 clients that I'm servicing, and then, but over the period of 2 years, I've serviced probably 15 to 20 clients. Now, I'm able to offer different things, and so that's why, to answer the question directly, right now I currently am servicing 6 or 7 clients. But then over the past 2 years, it's been probably around 15 to 20 clients. And so now my clients have expanded to like nursing homes or rehab centers. And my business is growing differently in a billing and marketing way. It's growing.
And did you have to fire some of your clients because they weren't the type you wanted?
Yes,
Yeah.
unfortunately. So that's where
Well,
you kind of have to earn that position, though, to be able to say, you know what, I think that you're better off, doctor, getting a biller because you can't afford me.
yeah.
Which,
Okay.
like,
Yeah.
we're very specialized in what we do. So
Yeah. Chelsea was asking if passing out the book was working for other licensees in terms of getting doctors. And yes, Chelsea, it's been fantastic marketing tool. I don't know of any other way that you could build huge credibility so fast than to be, like Jennifer said, almost a co-author here with a doctor. So it's been a wonderful marketing tool. And just so you guys know, we are working on another one. Eric said something about that earlier, so I'm going to go ahead and turn on my webcam and show that to you here. This is the new book that Dr. Ragnar and I are finishing up right now, and it should be on Amazon and in the bookshelves really, really quick. This is, I don't know if you can see the title there. I'm going to hold it up to the camera. 9 Ways Physicians in Private Practice Let Money Slip Through Their Fingers.
Mm.
And the subtitle is, And How You, Doctor, Can Avoid Losing Literally Millions of Dollars. You think that'll be a good one, Jennifer?
Mhm. That's to the point. Yeah, that'd be a great one. I can't wait to read
Yeah,
that.
yeah. All right. So
Any other
here's one.
questions? Mhm.
Yeah.
Yeah.
Hey, how about this one? Anna's asking a great question. How long did it take for you to get your initial investment back?
Oh, I got it back within probably like my initial investment. I probably got back within seven months.
Yeah. That's
Yeah.
great. You know, a lot of people don't realize it, but new businesses, if they get back their initial investment in starting that business in 2 years, you know, if they get into the black ink out of the red ink in 2 years, they're doing great.
Yeah. That's true.
Because I said something about you firing clients. Now we've got a couple of questions coming in from on that
Oh,
topic as well.
I
Yeah.
can't see the
Uh,
question, so you'll have to let me know what they're asking, or if there's any specific question.
yeah. Well, let me ask you, Jennifer, you did,
Yeah.
you know, mention about how many employees you had, 7, I think you said, or contractors that do the data entry for you. Is that what they do?
Mhm. I have
Yeah.
certified billers, certified coders, and then
Yeah.
I have like different positions.
And how many, you said client practices, I think you said about 8 practices. Is that the number of providers, or are there multiple providers in some of those practices?
That's the number of providers.
Okay.
Yeah, because so
And
like let's say Go ahead. Sorry, Patrick.
well, I'm sorry. I was just going to say Claude is also asking how many claims are processed in an average day or week or month.
Uh, in a day, it could be for one doctor, or like so. Let's just take one doctor. One of my clients, it would they'll maybe there's like 20 to 25 claims in
Yeah.
one day,
Hmm.
um, for one doctor.
Yeah. And can one of your employees, we'll call them employees, can one of those people do those 20 claims, 20, 25?
Yes, yes, very easily. So
Yeah.
my I hire billers and coders that are at a pretty advanced level, so that when they're done doing their billing, they start doing other work. They start doing other tasks for me, inclusive of collections and things like that. So the billing portion doesn't take that long, especially with this system, the iClaim system. So they're able to quickly go back into like maybe playing different roles, cleaning up coding for me and my doctors, making cheat sheets for my doctors, things like that. They'll do extra work.
Yeah. Eric, what's some other questions?
All right, let me get back over to there. How about, again, Marie Carmen's asking, what is the average percentage that you're charging, specifically since you are working with surgeons and other specialists?
I would say the average is about 7%. And average meaning, like, I have one client where we're down as low as 5.5%, which I could go as low as that because these are specialists and surgeons. There's not that many claims, but the claims are very tedious and very like they're high dollar claims. And then I have one client that, when he first signed me on, he said, for every claim that you get, you can have as much as 50%. So that's, it just really depends on the client and at what level you're at in terms of closing them and for what. So I hope that didn't confuse her, but I would just say my average is like 7%.
Yeah. So, folks, what she's referring to is you're charging a percentage of the money that you collect for the doctor. So, if you're billing out $100,000 a month for a doctor, then you're charging 7% of that. Then you're making $7,000. That's just simple, easy math on that. All right, Eric, what else?
All right. Are contracts with the clients time limited, or do you have them renewable?
That's from Chelsea.
Yeah.
Okay, great question. It depends. So they are, um, they're not, they're renewable every year, and they renew every year automatically if the doctor has no problems or complaints.
Yeah, you build that in, don't you, where it's just automatic renewal, unless they, for some reason want to, change something or try to maybe negotiate with you on things. Yeah,
Yes.
good.
Good. Yeah. And here's just a good general question here too, Jennifer, about monthly expenses. So basically, other than office rent and salaries, do you have any other particular monthly expenses that you're having to deal with?
Yes. So aside from those that were mentioned, the other expense would be the expense to partner up with our IT partners. So to use either their software or to partner to get somebody to come out and do the coding audit, depending on whatever service you're getting for that doctor. Uh, you the other expense would be the partnering up with the IT partners. There's
Yeah,
so I'll give you an example. There's there's some type of software, or not software, it's a platform that doctors can use to get on to try to look up real-time eligibility. And so I know that if a doctor wants to use that specific platform, I'll say, okay, you can use that platform, but I have another way that you can use it at a less expensive cost than what you're paying now. So then the doctor will say, okay, I'll go with you. So then I'm paying for it out of my pocket for him, and then through the billing, I'm paying, or he's paying me back. I don't know if that makes sense, but yeah, that's the additional expense aside from office expenses, rent, and salaries.
right. That was that question that I see from Mark? Is that right, Eric?
Yes, that's exactly. That was, well, actually, that was, okay, I jumped ahead on that one. Yes, that was from Mark. That is correct.
Okay.
And then Chelsea,
They're all great questions.
yeah, Chelsea asked similar questions about the renewal time on the contract. So I think we can go on. I think Marie, you were asking to see the title of the book. So I think Pastor's got that up there on the screen. And let's see, Jennifer works are, let's see if I can get it. Jennifer's workers are certified coders, but generally they don't have to be certified, do they? So let me see if I can. Claude's asking the question. So if you're using certified coders, they don't generally have to always be a certified coder. Is that correct?
They don't. However, in this day and age, I think it's something that's highly suggestible. If you are going to be hiring somebody in the general public to apply for this position or a position within your company, you ideally would like to hire somebody who's a certified biller or a coder, because the 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 processes now has gotten a little bit more sophisticated, especially dealing with IT, dealing with computers, dealing with payers, and how difficult they can get paid. Doctors can get paid. I think having somebody who's gone through the certification, you'll be rest assured knowing that they've gone through the healthcare certification, so they know what HIPAA stands for, or they know what CPT stands for. You're just going to put yourself in a better position if you hire somebody who is certified, because you're going to know that they have a level of learning about healthcare and billing that you're not going to have to start from the bottom. So that's just my preference. I prefer to hire someone who's certified, because it sets me up to say, okay, I want you to be the expert, and I want you to teach me about coding for a neurosurgeon. So that's just my expectation, is that down the line, I would love for them to become their own experts, and they could start at a certain level when they're already certified.
Right. And by the way, somebody's mentioning the fact that Claude says, don't most licensees depend on ABS for coding expertise? Well, folks, we don't actually have in our office coders, but we do have a network of certified coders that you can utilize through what we call CodeWrite. You'll see that on the screen there. That's one of the ancillary services that we provide to you that you then can provide to the doctor. Yeah. Anna wants to know when you started hiring people. How did you know it was time to hire people?
For me, it was probably about a year, maybe a little bit more than a year.
Okay, and that
Let's
kind of
see. Actually, sorry, not. I'm thinking about it. I had to hire people sooner than that. For me, I had to hire them almost within 3 months after training. I was already pursuing some certified billers and coders and people who had experience, because I needed help with the 3 clients I had landed right away.
right. You made the mistake of getting started too fast.
Yes, yeah, too fast was the problem.
Yeah, yeah. Kurt wants to know, when you first started, were you able to do all the work yourself? I guess you did, but that's when you started looking real fast after that, huh?
Yeah, I think no. That's actually a really good question. So with three clients, could you do the work by yourself? The answer is yes, you could, but you will be overworked. So I think that pulling at least one more person to help you, I would say 2 billers for every 3 clients would be good.
Yeah. Okay. Yeah, because like you said, if one person can do 20, 25 claims a day easily,
Mhm.
then you could certainly do more than that if you wanted to put in the time, or start hiring. You'll know. You just kind of know, don't you,
Yeah.
when it's time.
Yeah. You'll know.
And
Hey,
Ashley wants to know
Jennifer,
if you.
I was going to hop in there, Patrick, right on top of you. So sorry.
No, go ahead.
I thought this was a good one. Ashley's asking a question about, do your employees make an hourly rate, salary, or a percentage?
That's a great question. So my employees work on an hourly basis, and then before I even get them on an hourly basis, I like to offer them a 1099 position first. So I offer them a 1099 position, and I say, you can start with us and just show me what you've got. So they start doing some of their coding and billing expertise, and I'll pay them per project. And then if I feel comfortable with them, I put them on an hourly rate.
Yeah, and by 1099, she means they're just independent contractors. You
Yes,
fill out one form at the end of the year telling the government how much you paid them during the year, and then of course they handle their taxes themselves.
yes.
Two questions here kind of tie together. Larry is asking about, is Jennifer's office a home office, and do her assistants work remotely, or are they all in a traditional office setup?
That's a great
And
question. Uh,
Chelsea is asking something similar to that.
so I do have a home office. I just bought a house actually about 3 months ago, so I'm really excited about that. And
Oh,
of course,
congratulations.
thank you. So the first thing I thought of was I need an office. So I want to continue working from home. So I have my home office. I train them. I train my employees at my home office, but essentially they work from home on a HIPAA secure network.
Right.
They're able to access these platforms through their own computer. Everything is secure, and so they're able to work from home. And I think that's one of the first things that attracted them to this position, is that they have a lot of these are, they want to be able to work from home and have the same autonomy that I do, but still be in like a structured environment. And because of IT and electronics nowadays, we're allowed to have sort of that freedom, but at the same time, we're still able to keep track of our work. and what we're doing and our outcomes.
Yeah. By the way, I put the picture up you sent of you just kind of laying back, relaxing there at your desk, and because, so this is your office. You're actually renting some space, or is this in your home?
And this is in my home.
Oh, cool. Uh,
Yeah, so
I
I've
don't know if
converted one of the rooms.
I don't know if everybody can read the little quote there on the wall. Can you tell us what that says and why you put that up there?
Yeah, it says nothing is impossible. The word itself says I'm possible, and that was
I'm
a quote.
possible.
Yeah,
Yeah,
and
I love that.
that was a quote from Audrey Hepburn.
Oh, you've got such a great outlook and attitude, Jennifer. I can see why you're so successful. Eric, I've got to run, getting ready for another call.
Sure.
Jennifer, do you mind staying on here for a few minutes? Let Eric kind of finish up a few questions. I can't believe we have so many coming
Sure.
in here. Yeah.
You bet. Yeah. So, Patrick, thanks for taking your time. I know that it's important for you to be able to do this. And so, Jennifer, yeah, if you've got just a few more minutes, maybe about 5 more minutes, and then I'll take the
Sure.
last 5 minutes to kind of close out everything. Let's
Jennifer,
see.
thank you. Thank you so much, Jennifer. I got to run,
Of
but thank
course.
you for being on here today.
Okay, thank you,
Bye for
Patrick.
now.
Okay, bye.
Yeah, thanks, Patrick. You know,
Thank you.
you'd mentioned earlier, this is a great question, and I think you piqued an interest here with some people. So,
Mhm.
but Gregory asked the question about, you mentioned something about being too expensive for some practices. Can you explain a little bit more about that and what you really mean? And then I think there's some more kind of follow-up questions I'll ask you about that.
Okay, so I hope I didn't come off offensive by saying that I was too expensive. I think what I mean by that is, I think because I've like I said, when you go into this business, you want to become an expert, you want to become a credible resource to these doctors, and if you're able to establish your foot in the door in your community, uh, especially with other doctors, and they know you, they hear about you, you're getting your name out there, you are able to put yourself in a position where you can dictate what type of clients you want, where you want to work, and how much you want to charge. So I think that the reason why I said, I'm too expensive is because for a primary care doctor, someone who wants to hire me, if they're offering me like a really low percentage, like 4, 5, 6%, there's not going to be a good ROI for me, meaning a return on investment. Uh, so that means that when I go in and I see this primary care doctor, I'm going to be giving him a lot of my time. I go in, I talk to these clients, I make them feel super comfortable about who they're working with, the claims. I put a lot of attention to the claims. If there's anything rejected, it gets handled right away. There's a high level of attention that I bring to my customers and my clients. So they're not just getting some biller that was recently certified who gets $13 an hour. If they essentially want to hire Prosperity MD, they're hiring me and they're hiring consultants. Consultants are ones that are going to come in and do more than just billing. The way I look at their book of business is, let me help you turn your practice around so that you can essentially make more money over time and concentrate on your patients more. So when I go in with that value added attitude, I'm more than just a biller. I come in as billing is just one caveat to what I can offer you. I can offer you so many things to help you grow and turn your practice around. So I think that when you position yourself like that, naturally I'm a consultant versus some biller that you're paying that's going to equate to 4% a month. And I
Yeah.
would rather charge this doctor 8% because I'm going to say, look, when I walk out of here a year from now, you're going to look back and think, wow, I grew 4 to 8% in my business, and that's contributed to Jen or Prosperity MD. So that's why, I guess in a nutshell, that's what I meant to say, is that I value my time and I know what I have to offer, so
Sure.
I place my value where I believe it stands.
Well, I'm glad you said that, because just I believe it was last week, Adam and I, or it was 2 weeks ago, Adam and I did a webinar on understanding how confident you need to be in this business, because again, like you just mentioned, you're bigger and better than just being a medical biller. You really are a consultant. And so, you know, you don't always have to be the lowest ones just trying to get that client. I think obviously sometimes that can be the worst enemy of trying to be the cheapest one out there just so that you get a client. I think it's I think bumping that up to the level of what you mentioned there certainly is right on target. And you know, it's just like you said, you're a certified medical revenue manager, not a biller. So you're really looking at the holistic part of that doctor's office. So I really appreciate what you had to say there. Let me see if I can find any other questions here. Anna's asking just a brief question here. How often do you end up visiting your clients?
Oh, I visit them maybe once every 2 weeks.
Okay. All right. And then one other one, this is one that's kind of come here just at the last part of it. And Kurt's asking, how many attempts does it take you get in front of the doctor, quote, past the gatekeeper?
So for that question, it usually takes me one attempt. Well, maybe one or two, but I've had I used to be in the pharmaceutical industry, and so I've had a little experience dealing with doctors and how to get past the gatekeepers. A lot of the times there's an art to it, and I don't realize, but I must do it in a certain way. I don't know. I really don't know the question, but usually takes me one or two attempts maybe, and then I'm usually at the doctor's
That's awesome.
desk.
Well, you know, one of the things that you mentioned earlier, and then we can kind of wrap up with this, and I'll kind of close it out here, but that is, I think the importance of you being a part of your community. I'll let you just share a little bit about that to kind of close us out, and what that does, because I think that ties back into what you were saying earlier about building that trust with not only the doctors, but again, your community.
Yes. So I think it's important as you know, an ABS licensee is that you know, you go into this thinking you're going to take on a business. However, in healthcare, doctors actually need us. They need consultants like us who understand a little bit more than just the billing. They understand sort of the aggregate or bigger level of what's happening in healthcare these days and how it's affecting doctors' pay.
Right.
Because doctors, we cater to doctors who have private practice. That basically means these doctors decided to go off and run their business on their own, just like us. And so there's already a partnership there. If you think about it, this doctor and you are doing the same thing. You're going out there and you're starting your own business. These doctors started their own business. You're just there now as a partner trying to say, hey, let me help you. That way, if I help you, I know that I'm ultimately helping your audience of patients or your universe. And that's why I say, you know, really getting involved with becoming sort of that community leader. It's how you massage your message to a doctor that's going to determine whether you're impacting or you're just selling.
Right. Yeah, I think that's the big part of what you just said there, and I think some of the things that obviously that you're doing with your you know, with your nonprofit organization of what you're doing, but the activity that you're doing in your community of just getting people to know who to like, know, and trust, and that's just what it gets down to. So I certainly appreciate your time today, Jennifer. Way to go!
Thank you.
That was so exciting. I feel so privileged because I was one of the first ones to help you do the demo with your doctor, and I remember you calling me up and saying, "Eric, we just signed him," so that was pretty cool.
Oh yes. So really, it was all thanks to you, Eric.
Thank you so much.
To get you to do their demos.
Absolutely. All right, Jennifer, thanks so much. I'm going to wrap up here with a few closing parts, but Jennifer, thank you again. I know Patrick will get back in touch with you, and we'll be checking back in with you very soon.
Okay, sounds good. Have a great day. Bye, everyone. Thank you for listening.